So then those are going to find that in long bones. Okay? And then long bones, what kind of bone is that going to be? Spongy bone or compact bone? Or both? Okay? So it's going to be compact bone in the middle portion of it, and then the distal ends, it's going to be spongy bone. And then you can have short bones, like a lot of the bones in the carpals and the wrists and the tarsals. Little cube-shaped bones, triangular-shaped bones, things like that.
How are these formed?
Those are probably, I think, going to be the membranous, but I'm not for sure on that, so I will find out. And I'll get back to you.
Do you want me to email you?
You can, or I'll make a note of it here. And then also these are going to be bones that are formed within tendons. The biggest bone that's formed inside of a tendon is the patella. You can have other little sesamoid bones, but the patella is the main one. Well, I mean, the patella is pretty much has tendons above it, tendons below it, and it's kind of surrounded by connective tissue, so it's within the tendon. I mean, basically, it acts as part of the tendon. It gives it more leverage, because on the knee, you can have a lot more strength. If this muscle tendon was going across the knee like that, and there wasn't any bone in it, it wouldn't have as much leverage. But when you have the bone on there, it gives something to pull against. So it's going to add to the strength of it. So then you have irregular bones with complicated shape, like the vertebral bone or the vertebra. With the hip bones, in the proximal part in the hip, you have the greater trochanter, lesser trochanter, the femoral head, different things like that. All right, so what we'll do is we'll just go through this part about blood supply and innervation, and then we'll take a break and talk more about the physiology of bone growth and homeostasis and things like that. So bone, again, is going to have a lot of blood supply because it's in the growing stages. Obviously, you need blood supply. If it's being built up and broke down, it needs nutrients going in and out. And again, some of this blood supply things are going to get into a little bit more detail than you're really going to need to know for a long-term basis, but at least you have the background of it. So there's certain general concepts that you want to understand with it. Number one is basically the fact that it has a rich blood supply. 10 to 20% of the output of your heart is going to go to supply your bones. And then different types of bone are going to have more blood supply. There's significant things about blood supply on certain bones, like on the navicular or the scaphoid bone in the wrist. It has two different parts of it has different blood supply, and when you have a fracture to that bone, you can get osteonecrosis. So it's an issue where one of the parts of the blood, when there's a fracture, it's going to lose its blood supply, and you can start developing osteonecrosis. It's much more of a complication for fractures to that bone rather than other bones of the wrist. And then red bone marrow areas are going to obviously need more blood supply because they're actually forming blood cells. So obviously those blood cells need to get into the blood system pretty quickly and has a lot of volume of them going in. So if we're talking about the diaphysis and epiphysis, obviously they're separated by cartilage, so they're each going to need their own blood supply. So you're going to have diaphyseal nutrient arteries and arteries that go to the metaphysis and the epiphysis. So the diaphysis is most important blood supply to the arteries of the artery to the long bones. you're going to have one or two principal arteries here, and then it's going to go through the the compact bone kind of at an angle, and it's going to branch off. And remember, those are the arteries that are going to go through those little openings, that are canaliculi and things in the bone tissue. So there's different pathways that all the blood vessels can go through to get to different parts of the bone. And so then it's going to divide into ascending and descending arteries, and then also some of that is going to go into the medullary cavity to supply that area. And then you have blood vessels that go to the metaphyseal plate and the epiphysis. Like I said, those are separate parts of bone, so they're going to need their own blood supply. And then while that epiphyseal plate is still growing, obviously you're going to need a lot of blood supply there. Right? So that's where the bone is being formed as it grows. And then also, since those are going to be adjacent to the joints, there's going to be blood supply that's going to get into those. I mean, actually in the cartilage itself, the cartilage is dense material, there's no blood vessels that go through the cartilage. The way they're going to get their blood supply is from where it attaches to the bone, either at the base here or around the periphery. And then the periosteum is going to have its blood supply as well, because that's where you're going to have bone-forming cells, the osteoclasts and osteoblasts are going to be on that inner layer of the periosteum, so they're going to need blood supply to get their nutrition to either lay down bone or break down bone. And then also, when those osteoclasts break down the bone, that calcium is going to go up into the bloodstream, so it's going to need blood supply for that. And then when you talk about the irregular shaped bones, obviously they're going to need blood supply as well to the periosteum. And then it's going to go into the medullary bone where the bone marrow is. All right, so we'll take a break here and So there was a question about the bones, like the irregular bones in the hand and wrist and such, and which ones are intramembranous and which ones are cartilage. I don't know the reliability of the source, but basically saying that intramembranous is pretty much the membranous bones in the skull. I would think of it as that there's probably bones that have long, flat surfaces, which are mostly going to be the bones of the skull. Maybe the pelvic bones, but just so, mostly the intramembranous, we would say that it's going to be the membranous bones of the skull. Whereas if we're talking about short, irregular bones, those are probably going to be endochondral. But it's possible that some bones maybe have a little bit of both. Okay, so now we'll talk about the physiology of the bones. And what that has to do with, basically the bone has a state of homeostasis, okay, where it tries to adapt to different changes that need to occur, but it tries to reach, again, a state of balance. So there's a balance between having enough calcium in your bones to keep them strong, and also have enough calcium for circulating in the bloodstream that the body needs for other purposes. And then we'll talk about hormonal control that regulates it, what types of imbalances there can be. Sometimes you may have a situation where there's more bone needs to be deposited, more bone needs to be reabsorbed. Then you have situations where you have repair of bone, and then there's mechanical stress. We'll talk about how different stress to the different parts of the bone are going to lead to the formation of the trabeculae in different patterns. And then calcium homeostasis. So like I said, it's the idea that there's calcium that's distributed through the body for different uses. One of them is to strengthen the bones. Another one is for circulating through the bloodstream for other purposes. And then also talk about the effects of bone and how it relates to exercise.